Hi, let's talk about the shoulder musculature that's pertinent to the overview of the upper limb session. So this will be a brief video with some overlap between some of the remaining sessions, but I would just like us to focus first on what we're looking at here. So in this image, this is an anterior view of the proximal portion of the upper limb. We can see that the glenohumeral joint or the shoulder joint is located where the arrow indicates. The second arrow is indicating the elbow joint, and we can see this obviously is lateral. The first muscle that I would like to draw your attention to is the deltoid muscle. The deltoid muscle is one of 6 intrinsic shoulder muscles. These are muscles that span the glenohumeral joint, connecting the scapula to the humerus. Now, I'm outlining in red the deltoid muscle here. There are actually 3 parts to the deltoid muscle. There's the clavicular part originating from the clavicle. There's the acromion part originating from the acromion process. And then there's also the spinal part, which would be viewable from a posterior view, originating from the spine of the scapula. Now, these 3 parts all are capable of unique actions. They all act upon the glenohumeral joint. That clavicular part is responsible for flexion and medial rotation of the glenohumeral joint. The acromial part is the prime abductor of the glenohumeral joint, so it is what primarily abducts the arm or moves it away from the body. This is, of course, picking up where the supraspinatus muscle leaves off. The supraspinatus typically begins abduction, and the deltoid carries on with abduction afterwards. And then the spinal part of the deltoid muscle is responsible for extension and lateral rotation at the glenohumeral joint. In addition to the deltoid muscle, there are other muscles affecting movement at the shoulder that are relevant to this particular session. And in particular, they're the biceps brachii muscle. Biceps means 2 heads, brachii of the arm. So looking at the arm, which would be this region here, the anterior portion of it, we can see there is both a long head and a short head of the biceps brachii muscle. That long head runs from the supraglenoid tubercle of the scapula. The short head arises from the coracoid process of the scapula. And these 2 heads come together as one to insert on the radial tuberosity. The biceps brachii muscle primarily acts upon the elbow joint. However, it does cross the shoulder joint, and the long head in particular is capable of some weak flexion of the arm. Regarding the Coracobrachialis muscle, this is a muscle which would be deep to the biceps brachii, which we can't see here. It originates on the coracoid process, and it runs to the medial portion of the humerus. The Coracobrachialis muscle is a flexor and adductor, and that's adductor, of the humerus. Thank you for your time.